And good afternoon, everyone. Thanks for joining us for this Thursday's COVID-19 press briefing. Today, Orange County Mayor Jerry L. Demings will discuss Orange County's efforts in assisting the state with the vaccination process, including some great work done by our women and men at Orange County Fire Rescue. The mayor will also give an update on COVID-19 testing, the work of our strike teams, and more. Mayor Buddy Dyer could not be here with us today, sends his apologies. However, Dr. Raul Pino from the Florida Department of Health in Orange County is here to discuss details on the vaccination process and to give us an update on COVID-19 data trending in our area. We want to remind all of our reporters, we appreciate you being here. Please, just one question during this open portion of our press event. The mayor and Dr. Pino will remain afterwards for additional questions. We'd like to move through this press conference with dispatch. We will begin with Mayor Demings. Mayor?
All right, good afternoon. Thank you for being here. Welcome to the 106th press briefing for the novel coronavirus here within our community. And when we think about that, since March of last year, we started this process, and none of us could have predicted where we are today. Earlier this week, we had the opportunity to unveil a time capsule that was buried at the Orange County Courthouse back in 1995. And at that time, there were various predictions that were made, but none of them hit the mark in terms of predicting that 25 years later, there would be a pandemic that we would have to respond to as a community. So we'll see what the next 25 years holds for us. You can never predict the future with certainty, but I know that in terms of our community, we've had positive things that have happened over time. And so I say to our community, as we do respond to the virus, thank you. Keep up the good work that you're doing to help slow down the spread of the virus in our community. I want to also acknowledge Advent Health for partnering with Orange County to offer free vaccinations this coming Saturday. These vaccinations will be made available to local doctors and dental offices who are not in the immediate hospital network. Therefore, Advent Health, that will be done at the location out near the airport that we have talked about previously. The 3,500 appointments for this Saturday filled up very quickly within 1 day of opening up the portal. As the state hands out more doses, the Department of Health in Orange County may be able to earmark more for healthcare workers so that we can share this opportunity with them again in the near future. I look forward to working with Advent's vaccination site, and I plan on visiting the site this coming Saturday myself. For more information about available vaccine opportunities, you can go to our website at ocfl.net/vaccine. Also, I'm thrilled to give you an update. The numbers are looking much better here in Orange County. Our latest reports indicate that 6.1% of Orange County residents have received their first COVID-19 shot. That translates into 91,331 individuals who received their first shot. As for those who have completed the entire vaccination series, that means that they have received both shots. That number is 27,373, which is about 1.8% of our population. So the converse of that is we have a long ways to go. If 1.8% of the population has received the vaccine, that means that we have about 98.2% that still need to receive the vaccine in our community. So I look forward to being engaged with the media, our other community partners, to ensure that we get to that number sooner than later. Even as we speak, hundreds more are receiving the vaccine at the Orange County Convention Center, which is open 12 hours a day, Monday through Saturday. I couldn't be any more prouder, at least, of the efforts of our Orange County Fire Rescue Department paramedics. So far, they have set up mobile vaccination sites at 12 different senior living communities and places of worship. Yesterday, 235 seniors were vaccinated at the new church of faith in Pine Hills as part of our outreach efforts in the minority community. We are continuing our conversations with the state on what we can do to increase inoculations for minority communities. We know that there are disparities in the numbers or data related to those who have been vaccinated to date, and we want to try to close that gap. 64 seniors received their first COVID-19 shots at the Valley Manufactured Housing Community in Apopka this morning. So far, the paramedics have vaccinated 2,675 seniors who were unable to get to the convention center. So thank you to the paramedics here within Orange County. Since the start of the pandemic, there are a reported 104,989 positive cases of COVID-19 documented in Orange County. Sadly, the latest figures show 990 Orange County residents have died from the disease. 990. We do offer our condolences to those who lost loved ones as a result of the pandemic. Further good news, though, is that our 14-day rolling positivity rate continues to decline. Today, Dr. Pino and the Department of Health indicates that we are at 10.2%. So we look forward to next week seeing that number decline to single digits. In order to do that, I think testing becomes very, very important to ensuring that people know their status. Our Barnett Park coronavirus drive-through testing site will remain open for another 24 days. That site is run by Orange County Health Services. Residents can get a rapid or antigen test or PCR test or both through the end of this month. The site is open 9 a.m. to 5 p.m. 7 days a week. You can get information about the testing by going to ocfl.net/testing for more information. I want to give you an update on our compliance team efforts since December the 4th of 2020, the day that I signed that executive order, ensuring that we were able to find businesses that we found to be in violation. We have handed out over 108 warnings and 22 citations to businesses that refuse to comply with our county mask mandate. Fortunately, we are talking about a very small number of individuals or businesses who are non-compliant. The teams have conducted over 8,000, in fact, 8,168 inspections since this summer. Overall, 99.3% of Orange County businesses are in compliance. Our teams will continue to go after the bad actors to make sure that patrons and employees remain safe. Finally, for today, as we come to the close of this week, I want to wish best wishes to the Tampa Bay Buccaneers as they take on the Kansas City Chiefs in the Super Bowl on Sunday. Of course, Tampa Bay is a Florida team, so if you are Floridian, I hope that you're going to root for the Tampa Bay Buccaneers. I am wearing, once again, my Tampa Bay pin today in honor of Tampa Bay reaching the Super Bowl. Even though the Super Bowl is not a national holiday, we kind of treat it like it's a national holiday. And it's a time where it's usually large gatherings. But I have some tough advice for you, the public. If you do get together to watch the big game, please limit your gatherings to family members only. You really don't want to be around people you haven't had much contact with during this pandemic. Otherwise, you risk exposing yourself to the virus and a greater percentage. So keep using your common sense in this regard. And I know, as my dad would say, common sense is not common. But in the words of Dr. Anthony Fauci, our nation's top infectious disease expert, he says these words: lay low and cool it instead of going to parties. So go Buccaneers, bring home the trophy. Dr. Raul Pino, I'm going to turn it over to you at this time.
Mayor, just to emphasize on what you just said and the importance of washing your distance, washing your hands, wearing your mask, and keeping your groups to small gatherings, we confirm that the UK variant has been detected in our county. That is B117. I didn't have this information, Mayor, when I talked to you around 1 o'clock. It was acquired probably in Mexico during a trip, and we have traced and investigated some of the individuals in the trip, and some are out of state as well. That's all the information that we have on that. So it's critically important that we do not take our guard down, that we continue to wear our mask, even if you are vaccinated, that you continue to wash your hands and watch your distance. This variant seems to be more infectious, spread rapidly, and they, in some cases, seems to be deadlier than the ones that were circulating before, even if that's possible. As of today, we have 104,989 cases, and the good news is that our recovery rate continues to increase. It's at 94% right now, and that's evidently showing in the data. The number of deaths, as the mayor mentioned, has reached 990, and probably will be over 1,000 when we talk to you next. 33 additional deaths has been added since the first, and those were 16 female, 17 male, 9 black, 5 other, 9 white. For ethnicity, 10 Hispanic, 23 non-Hispanics. We have 22 with underlying conditions, 11 that we don't know, and 31 of the deaths were in January, and 2 were just recently in February. 9 of the 33, 27%, occurred in assisted living facilities. Based on the data that we had this far, January is inching to be the second deadliest month. It all depends when we end the counts. Remember, sometimes data lags. So far, January this year has 174 deaths. The deadliest month so far was July 2020, where we have 228 deaths. And the second deadliest was August 2020, where we have 189 deaths. That was the peak of our summer. We peak actually in July, but then we experienced some of these deaths a lot later. The Super Bowl is not a national holiday, but it better be, most so if we win. But please, please adhere to the advices given by the mayor and those by the CDC so that we continue to experience a downwards in our data. With regard to the vaccination, we have vaccinated in the county 119,989 shots has been given in the county. Of those, 118,714 were given to county residents. With first doses, we have at least 91,341 individuals, and that is a 6.1% of our population. Non-residents that have received vaccinations in our county, 1,275. As I mentioned to you before, and let me say it again, please continue to wear a mask, continue to wash your hands, and wash your distance even if you are vaccinated. The vaccine protects against death and protects against severe disease, but there is no sufficient data right now to say either way if it protects against infections or if it protects from you transmitting to other ones or acquired, or if it prevents asymptomatic infections. So there's a lot of analytics that have to happen. So we, with this new variant in town and surrounding us, Remember, these are more infectious. They spread rapidly. They have been seeing a number of reinfections with this, and it will not be abnormal for someone who is vaccinated to acquire the disease that had happened. So please keep yourself, protect yourself, your family, your friends, and coworkers. And if we do this, our data will continue to trend in the right direction. Hospitalization, ICU bed use, and all the data related to hospitals have continued to decline. It was a small increase during the week in hospitalization, but I don't think that is that significant at this point. With that, any questions that you may have, Mayor?
All right, thank you, Dr. Pino. Just as a reminder, if we have Spanish-speaking media here, we have the ability to translate. I see that Commissioner Gomez-Cordero has joined us, and we have Ms. Ilia Torres, one of my special assistants, who can assist with the translations. And with that, we'll open it up to questions at this time.
Hi, good afternoon. Edgar Carrillo, Telemundo. I'm going to ask the question in English, but I need the translation for the answer in Spanish to save some time. It is very likely that the Super Bowl also translates into more people visiting this week or this weekend, the city of Orlando as well, as Tampa. Are you considering to activate the strike teams in a more widely manner during these days of special events?
Well, first, you're correct in the assumption that people are traveling here. The reports that I have received essentially on a daily basis from the international airport is that we're going to translate in Spanish. Okay. All right, Ilya.
Primeramente está correcto en la asunción que hace, que tendremos más visitas en esta temporada. El alcalde recibe de parte de las autoridades del aeropuerto ciertos informes.
Our airport has generally been the #1 airport in the nation for air passenger travel for the last several days, several weeks. So your assumption is correct that people are traveling here.
Nuestro aeropuerto internacional de Orlando por las pasadas semanas y días ha sido primero en la nación en el tráfico de pasajeros. Así que está correcto en la asunción.
However, I will remind you that as Dr. Pino gave you the numbers, our numbers are declining because of many of the measures that we have put in place.
De todos modos, quisiera recalcar que, como el doctor Pino comentó, nuestros números han declinado debido a todas las medidas precaucionarias que hemos tomado.
We want to keep the numbers low.
Queremos mantener los números bajos.
So, yes, we will be sending our compliance or strike teams out into the community this weekend.
Por lo que la respuesta es sí, estaremos enviando nuestros equipos de cumplimiento a los negocios durante este fin de semana.
However, that does not mean that the bars and nightclubs can't operate and do so in a safe manner.
Eso no significa que los bares y los clubes nocturnos puedan operar de manera segura.
Our goal is to ensure that people can gather and do so safely.
Nuestra meta es que las personas se puedan congregar y que lo puedan hacer de forma segura.
And we encourage them to have a good time while watching the game.
Los animamos a que pasen un buen rato mientras ven el partido.
Okay.
Amanda, I'm sorry?
There she is. Amanda's over there today.
Confused you because I moved over.
Yes.
Amanda Dukes from WESH TV. Dr. Pino, my question is for you. I want to talk a little bit more about this UK variant. If memory serves me, it was either last week or the week prior, you did say that there had been evidence it was in Orange County with a non-resident. Is the difference today, are these residents? Okay. And how many have been tested positive for this variant, and how many have potentially been exposed as a result?
So only one person so far that we know. Again, as I mentioned to you before, it's safe to assume all along that has been here. All these analytics are retrospective, so sometimes when you learn, the person has already moved around and done a few things. He is the only one residing in the county. Others individuals in the traveling party are not county residents.
This Steve Houdet from the Sentinel. This is for Mayor Demings. Besides wanting a prediction on the score, I'm more interested too in what you think the advantages and disadvantages of the federal program rolling out to retail establishments, the vaccine sometime next week, probably here.
I believe that the advantage of the federal rollout will ensure that all segments and sectors of our American communities will get vaccinated at a faster pace. So I'm very optimistic about that, particularly with rural communities that are small, that don't have the logistical support that large urban counties have. I believe that the rollout will benefit those areas because of the additional retail outlets that will be available. We had a conference call yesterday with Jared Moskowitz, the director of the Florida Department of Emergency Management. It was a statewide call, and counties from throughout Florida participated in the call. And he indicated that they are looking for additional opportunities to distribute the vaccine throughout the state. And so we're just trying to get clarity on what those opportunities look like. But he indicated that the inventory of vaccine will be increasing significantly in the coming days and weeks.
Lauren Seabrook, Channel 9. My question's for Dr. Pino. I had seen a statistic somewhere that in Florida we were only doing sequencing about 0.3% of cases to look for these other variants. Do you know how many of our cases are actually being tested for this? And kind of, can you explain how that process works so people can understand? Because we know there's one case, but it seems that if only 0.3% are being tested, that there could be a lot more of it out there.
So what you are referring is in-depth surveillance of all cases at the national level to be able to look for these genetic modifications. There is a belief that the in-depth sentinel testing monitoring that we are doing for variants is not sufficient. Because you try that with the total number of cases, and that's normally how you measure that. Now, keep in mind that the total number of cases in this pandemic are not the total number of cases that we have seen of any other infections before. So even 0.1% is million of research. The way that we do here, and next week Albina will be coming to go more into detail how this works and how the CDC works with this. We were planning to bring her today, but that was not possible. The way that it happens is through the monitoring process that we do with contact tracing. When you learn that someone has traveled to some of the places where the variant is in high incidence, then you do a little bit more investigation. And if you suspect that that could be the case, then that sample is tested for genetic sequencing to determine if that is the case. But the more specific, she will be able to give it to you next week. Well, at some point, it's going to be more general than that, as if a spread. On it. That was Siri. That was not me. And she's on it, so she may give you the answer. So, in this case for us, yes, as the number of cases increase, it may be a little bit different because then you expand to the contact tracing. So it could be now, for example, just as an example, not just the travelers, because the person that may have been in contact with him will be also sequenced to see if that transmission happened. So not only travel, but travel as the origin of all sequences that we are doing right now.
This is Kelsey Thord with West 2 News as well. My question's for Dr. Pino. Just kind of going off that, how much more worried should people be now that we have a confirmed case in a resident? And, you know, going into the Super Bowl as a potential holiday? You know, we saw issues after New Year's and Christmas. Are you worried that potentially this could cause issues with the joining of this new variant now and the Super Bowl?
So I don't think that the worries for us are today, in the sense that if we continue to do what we are doing, we should protect ourselves. I think the question, the larger question is if, and this will happen, if these variants become predominant and they spread faster than the regular variants. So we have to hurry and get vaccinated so that any future mutations of the virus do not affect the effectiveness of the vaccines. Right now, it seems that that's not be the case, but for sure, this will not be probably the only genetic modifications that we will see in the virus. And the concern is that some of those modifications in the future could make it resistant to the vaccines, or the vaccines ineffective in that sense.
Lara Greenberg, Fox 35. This question is for Dr. Pino, although Mayor Demings, you might want to answer it as well. Just regarding the seniors that aren't able to come to the convention center so easily for vaccines. We've been talking to a woman who's out in West Orange County, and she says that by her, she lives alone, she's in a trailer park, there's just no place for her to go that's accessible. How do you determine where to go, and what can you offer to people like her right now?
We, again, are sending our paramedics out into the community to those seniors who have pre-registered as persons with special needs. We do that for our weather phenomena, and we have a list. If this individual is not on that list, then I would encourage her to reach out to us, and we will make some provisions. So we are moving, just as I gave the numbers earlier, into senior communities, mobile home parks throughout the county, and we will continue to do that over time. In addition, we are looking for partnerships with other healthcare providers to ensure that geographically we are located throughout the county. At this point, we, being the county at the local level, do not control the supply of the vaccine. That is controlled, one, from the federal government, it goes to the state. And the governor has been the one who has controlled the distribution of the vaccine within Florida. Some of that may or may not change, but in either case, we are prepared here in Orange County. We have a plan that has the logistical support. So if vaccine is made available, we will be able to disseminate that vaccine and get it in the arms of human beings very quickly. So we're only limited today by the inventory that's available. We work really closely with Dr. Pino and the Department of Health and the state with the limited supply that we have today. But you have heard the president say that they will be rolling out hundreds of millions of doses within the United States. And I'm confident that as a metropolitan area, our goal is to get our fair share. So my communications with the state is just that. And we want to ensure that once we get additional inventory, that it is equitable, that all people have access to it. And so for that individual, if we get additional information, we will look out for that individual. So there is a process in place now for us to be able to respond to those types of individuals who are similarly situated.
If I can add, and the mayor mentioned all the points, just one little thing. We develop a risk assessment index, and any of these locations together with the county are run through that assessment. That assessment was based on a census tract level, that's the smallest level that we can have data. And it has number of deaths in that area, number of infections, and it takes into consideration socioeconomic index from the CDC, and those are ranked, and that's how the priority. That's one of the priorities. The other one is also distribution geographically across the county, so how you balance that. But just to give you an idea of what the mayor was mentioning about volume and capacity, our allocation for vaccines right now weekly from the state is about close to 9,000 doses a week, and for first dose. And just us, we can go up to 3,000. Advent Health can do 2,000. Just our two sites could do 5,000 a day in the county, but we get only 8,000 a week. So that's what's limiting us right now from expanding even further. We have trained all the paramedics, or most of the paramedics that want to be trained. Apopka area is also ready to do their own thing. Other areas are, but vaccination is the limitation right now. And we are giving about 2,500 a day in the convention center, and that is based on prior shipments that we accumulated on inventory. That has reduced right now. So the increase that has been announced will be very welcoming in our county because we have the capacity to do more, much more.
This next question was texted in from Peter Reinwald with News 13 from Mayor Demings. Can you elaborate and provide any more specifics on efforts to partner with churches in the vaccination process?
We have received a plethora of churches and places of worship that want to be designated as a closed pod site for dissemination of the vaccine. We just don't have the supply to be able to meet all of those needs. But simultaneous to that, the state has identified some locations and there are plans to do additional closed pods with some of those locations. I believe that at the point where the supply catches up with the demand, we will have the ability to be able to disseminate the vaccine at the local pharmacies, at the convention center, through hospitals, through other community-based locations that to be inclusive of places of worship and other places that want to be designated as such. We have a long way to go to get to that 79% or so of our population that needs to be inoculated. And Dr. Pino gave you some caution while we're endeavoring to get to that point is we still have to wear our facial coverings, watch our distancing, and wash our hands and do all of those things in the interim period of time. Then we are, to me, what I'm hearing Dr. Pino also say is that this has been complicated now by a new variant strain of the virus that potentially can spread more rapidly and be more infectious. So given that, that reinforces the need for our residents and citizens to stay with this for a period of time. I think the consequences of not continuing to follow these directions that are being given can be catastrophic. If the virus spreads, more people get sick, more people die. So we got a ways to go. So one of the things that I heard the director of the Florida Department of Emergency Management say on the call yesterday, he gave an example about where we are today, and it's been a slow rollout. The pace of inoculating people has been slow. And if we didn't pick up the pace, he gave an estimate that it would take us 80 weeks to inoculate the number of residents that would be needed to reach that herd immunity. I don't think, if the more time goes on, I think, typically, Doc, I think the worse this gets for everybody. So without the infusion of the vaccine within our population. So testing and people getting vaccinated is going to be crucially important to stopping the spread in America And so I know that, and I'm confident that both our federal government and our state understands that and are doing what they can to procure additional inventory of the vaccine so that all of you who have not been vaccinated can be vaccinated as soon as possible. With the supply, we have figured out a logistical plan to be able to inoculate many, many more people on a daily basis in this community. So again, we're only limited by the supply that we have today, and the supply is falling way short of the demand. The good news is people apparently will be willing to get inoculated, and we'll see how this turns out in the coming months. But we're committed here to working with everyone that has, I think, stake in this game.
This next question comes from Lauren Cervantes from WKMG. I think this is for Mayor or Dr. Pino. Her question reads, in light of the vaccine that was stolen in Plant City, what security measures are in place to secure the COVID vaccine here? How is it protected or secured?
Well, if we describe the measures, then we could have an issue. The vaccines are protected, very well protected.
All right, this next one comes from Deanna Albritton. For both of you, her question reads, how do you feel about vaccination rates in minority communities in Orange County, particularly among Black residents? Do you think expanding to Walmart and Winn-Dixie pharmacies will help, or does there need to be more targeted efforts like visiting senior living neighborhoods and setting up mobile pods?
So the data, so let me make something clear from the beginning. There are differences and they are not small. There are significant disparities in who is having access to the vaccine. It could be due to the fact that where we are located. It could be also what the priority groups were at the beginning, who more likely is employed in that type of job. So it could be a group of factors. And also the data is not very good, meaning not every single site is collecting all the information that needs to be collected to have a better depth looking into really what the issues are. But still, even with all that, the disparities are there. So the idea is when we have better inventories, we have acquired a mobile clinic that it could go anywhere in the county and just pop up and do vaccinations. But part of the issue, so people understand, is that when we receive 8,000 doses for prime is the first dosage, we have to use all the 8,000. And we may get 8,000 2 weeks from now, but are the second dosage for those that we receive. So we have to guarantee that those individuals are going to have it. It's kind of a chess game right now with the limited resources. But the idea is that through the Walmart, the Publix, and other institutions, Walgreens and CVS, remember most people in the United States live at 5 miles from a CVS all around the country. So that will be an easy fix. The issue, again, is inventory. But even with inventory, we have to make a concerted effort to reach our population, especially those who speak another language, also those who are culturally a little bit different, and what implications on vaccinations are in that culture. So there are a lot of issues. We are a very diverse county. So with that, it becomes a challenge, but we should have a strategy for each of those main groups that we are going to target.
The only thing I would add is that it's a multifaceted approach that we have to ensuring that we don't have the disparate impacts that is evident at this point. So the fact that CVS and the other pharmacies are being added contributes to the multifaceted strategy that we have. So it's a good thing, but it's going to have to include many, many other distribution points in order to reach that level that we want to reach of inoculations within our community.
Lastly, this is for you, Dr. Pino, from Ryan Lynch in the Orlando Business Journal. His question reads, since we are getting close to nearly a year with the virus impacting Central Florida, how are we expecting the positivity data in the next few months to compare to the first few months of the pandemic's impact here?
Wow. I don't know. If I could predict that, I would have some money. But, things have changed. Ryan was always asking the last question to the mayor. Now it's to me. And Lauren was always asking the first question, and she was like third or fourth. So something's happening in the water. So listen, I think that, and this is not any intention to guess, estimate anything or project anything, because I don't think we can. But right now, we are going to what it looks to be a good phase if we sustain the measures that we have put in place. There are not major holidays besides the Super Bowl, and I don't think that we are going to see a resurgence at the levels that we saw in the summer. As I said before, I think the vaccine is going to have an impact first in death rate and hospitalizations, and then later on, we have an impact in infections. There has been some decline, significant declines in the number of cases that we are receiving daily. For example, 2 weeks ago, we were getting 1,000 cases a day. Yesterday, we have a little bit over 300. So those are significant changes. It takes some time for the data to translate and to see it, but those who are accustomed to see the numbers, we are seeing positive signs. But again, one concern is colleges are back into the county, bars are open. The mayor mentioned to you in his last statement last week, this week, Monday. And the mayor mentioned this week about the visits that the strike team have done to some of those facilities. And we explored the data, and we can confirm there is some transmission happening in those facilities as well. So with that, what is important is to protect each other. And we can do this together. We can do it.
Thank you.
No, Scott Howard was here from the school district, and I forgot to acknowledge that he was here just in case anyone had any questions of the district. If not, this concludes this press briefing. The next one is scheduled for Monday, February the 8th at 4:30 p.m. We trust that you all will have a safe weekend coming up. And again, go Buccaneers. All right.